The South Orange County Economic Coalition is the leading business organization throughout the region. We've been the voice of businesses in South Orange County for more than 50 years, and we work diligently to promote a strong economic climate and provide updates on important issues discussed at the state, regional, and local levels. Our members include key community stakeholders, businesses large and small, as well as public agencies, all committed to building a strong business climate both regionally and within our local communities. We advocate for our businesses and members by taking positions on legislation and local initiatives that have a direct impact on our communities. We hold monthly membership meetings, meet and greet events with our federal, state, and local legislators, and provide an annual economic report for South Orange County. Educate, facilitate, advocate. We're the South Orange County Economic Coalition. Learn more at economiccoalition.com.
Economic Coalition, and the Director of Government Affairs for Cox Communications. I will be your moderator today. The Economic Coalition serves as the advocacy arm for businesses in the South Orange County region, and we're pleased to bring you today's program. Joining us are healthcare experts from Cigna, Memorial Care Medical Center Foundation, and UCI School of Medicine to discuss the current state of COVID-19 in Orange County. Many viewers are undoubtedly experiencing what can only be described as pandemic fatigue. But as we enter flu season, just as news reports are warning of a potential second wave of the coronavirus, it is important that we have the latest information. Before we hear from our panelists, I would like to remind our viewers that if you have a question during the program, please make sure to comment below. We will do our best to get to as many questions as possible towards the end of our discussion. I would also like to mention that today's event is adhering to all CDC guidelines. Our panelists and I are each sitting 6 feet apart, including one that is coming to us remotely, and we were all wearing masks right up until the broadcast began. And now I would like to welcome our panelists. I'll ask each of you to please introduce yourself. Tell us about your role and briefly describe what the last 7 months have been like for your organization during the pandemic, including any potential organizational changes you've had to make, as well as the biggest challenges you've faced. We'll start with Dr. Adam Solomon.
Good morning. My name is Adam Solomon. I'm a board-certified internist and the Chief Medical Officer of the Memorial Care Medical Foundation. That's the ambulatory arm of the Memorial Care Health System, which is comprised of Long Beach Medical Center, an acute care adult hospital in Long Beach, Miller's Children's and Women's Hospital, a pediatric hospital in Long Beach, Orange Coast Medical Center in Fountain Valley, and Saddleback Medical Center in Laguna Hills. The last 7 months have truly been a whirlwind. It started off with us bringing together what we call our command center. Unfortunately, we had experience with this back when Ebola started, but that was bringing together the leadership of the system and being able to accumulate any concerns or questions and then problem solve on the fly. And we mirrored that in each of our campuses, so they were also ready to disseminate information out and implement changes that were needed to make sure that everyone was safe. One of the things that the command center did initially was to prioritize what are the things we really need to pay attention to first. And the top one was safety for our patients, our physicians, and our staff. And one of the first things that we then had to deal with was adequate protective equipment. We're a very lean organization, and so we didn't have huge stockpiles of PPE available initially. And so figuring out how to source them and make sure that we had enough equipment to keep our staff and our patients and our physicians safe was a top priority. And fortunately, we never suffered through a shortage of PPE and kept everyone adequately protected. We also needed to think about when patients are coming in, how do we address the potential for some that may be infected and some that may not be? And so implementing screening for them to come in, be evaluated quickly, and then sorted out so the right protection was put in place, again, for the patients, the physicians, and the staff. And then how do we take care of all of the ambulatory patients that were afraid to come in or didn't feel it was safe to come into the office? So implementing virtual visits, telehealth, and a variety of other digital health solutions to make sure that patients could get care all of that needed to be compressed down and done very, very rapidly. And so now we're at a point where things have stabilized somewhat. We've learned a lot during that time, and it's now safe for people to come back, and we're just trying to encourage patients to realize it's safe. Be sure to take care of your health when we're here.
Wonderful. And now Dr. Michael Stamos.
Good morning. I'm Dr. Michael Stamos, Dean of the School of Medicine at UC Irvine. Thank you for having me here today. It's a pleasure to be here. Well, 2020 has been quite an incredible year. Last time this group got together was in January. At that time, we had a hint of an idea of coronavirus and what it might mean to us, but I would dare say none of us would have predicted what it has meant to us. On the backdrop of that, we have also racial unrest, political turmoil, an election coming up, by the way, make sure you vote. And then, if that wasn't enough, fire, right? And if you're in the Gulf Coast states, hurricane after hurricane after hurricane. So it's been quite a year. Pandemic fatigue is a great term, but it's more than just pandemic fatigue. It's actually fatigue from a lot of reasons. And so, you know, we've done a lot of the same things that Dr. Solomon talked about. In fact, we've been working with Memorial Care as well as many other health systems, including CHOC and other partners across the county to make sure that we're all in tune and we're all supporting each other. We also fortunately didn't have a problem with PPE. Part of that was because of collaboration with other health systems. We were actually able to help other health systems as well, but also because of our partnership with the other UC health systems and medical centers across the state of California. As an academic health system, we feel like we play an important role in the community, and our role is not just to our patients, but it's also to the greater community at large. And we have partnered and collaborated and consulted with many of those organizations, including the County of Orange, the healthcare agency, as well as many businesses, advising them on how to keep their employees, their constituents safe, as well as how to reopen safely. And we've done this in partnership with our partners, which includes a fantastic program in public health, soon to be a School of Public Health led by our fantastic new Dean, Bernadette Bowden-Albala. You may have noticed her name or recognized her name because just yesterday there was lots of news about a very nice testing program that was done in Orange County. 3,000 random members of our county population were tested for antibodies against COVID-19. So maybe we'll get into that a little bit more later when some of the more specific questions come up. But I'm just delighted to be here today, and hopefully we can shed a light on what else we can do to combat this pandemic.
Thank you, Dr. Stamos. And now we'll hear from Dr. Laura Clapper, joining us remotely.
Great. Thank you for having me here today. And I want to, there seems to be a lag, so I apologize about that, but I'm going to just keep going. And I think it's really important for us to, anyhow, I'm a board certified pediatrician. I'm the chief medical officer for Cigna for Southern California and Nevada. And part of my role is really working with both our clients, with our sales team, and also working with our provider groups and how, we're a health plan. So a lot of the work that we've done, and similar to what Dr. Solomon brought up and Dr. Stamos brought up, was setting up a command center, really working with our providers in terms of, as care changed so drastically into to virtual care, needing testing and all those things, what can we do to make sure that the providers had codes they could bill for, be able to make sure that we were notifying our customers of what needed to get done, making sure that they could, when they called in for questions, that they could find a provider that was either being able to help them virtually if they were at home, being able to find testing locations, know where to make sure that they were taken care of when they went to the hospital. And, when we talk about the challenges of the last 7 months, I remember so distinctly where my job and life changed, that Cigna had a patient that was up in Washington State with some of the initial U.S. Cases of COVID-19. And I got a call, what should we do? We have a COVID-19 patient in the hospital. And it really took getting together both the employer, trying to figure out how do we do contact tracing at a work site, how do we talk to the hospital about what's going on, supporting the family, talking to the public health officer in the county. How do we as a health plan support all these different features as we go across the employer, the work side, the other employees? We actually need to bring EAP in for crisis support, and then taking our more usual work of working with the hospital and just discharge planning and those kind of efforts. So it really required Cigna to stand up quickly. How do we support all these different stakeholders and most importantly, take care of the patient? So I think interesting things that Cigna's done, besides leading at the front about waiving cost share around testing and the visit and treatment, is also we've started the Brave Heart Fund, and that's to support first responders and the families of first responders and healthcare workers who've lost their lives. So similar to what you've seen, different like special warfare and other kinds of military funds, this is for first responders. We also have done other things trying to look at how to reduce reduce disparities. So really focus the Cigna Foundation on providing things like food and school lunches for children who weren't going to school, so supporting brown bag, other kinds of things to really think about how do we be an important community member. So that's some of the work that we've done in the area. In addition, we have also helped fund some of the research that's gone on around treatment. So there's several treatment studies that we helped co-sponsor. And while we haven't, I think, we haven't found the exact, the best solutions about treatment. I think really want to honor the providers who have been working on the front lines and who have really improved hospital care and reduced mortality in COVID patients. So I think that I want to thank everyone for having us here and having Cigna participate. Thank you.
Thank you each so much. All right, we're going to go ahead and dive right into the questions. Now, I want to ask, over the summer months, particularly in July, we watched as the case counts as well as the hospitalizations rose. Those have since stabilized and have gone down. In fact, I think we're at fewer than 200 hospitalizations per day since September. By comparison, in the summer months at its peak, I think we were over 700 per day. So can each of you tell us, what these numbers mean and give us some insight and context into how well we're doing based on the numbers? Dr. Solomon.
Sure. So the state has put up guidelines as to when we should open up, and it's based on how many patients are positive, what the positivity rate is, how many cases there are. And Orange County has done well recently. They've been able to reduce from widespread down to substantial. They were hoping to get to moderate. The numbers seem to be there, but they've come up just slightly, and so we're still going to stay in that substantial area. Fortunately, our positivity rate is down around 3.2%, so that's the 7-day trend. So it's doing better, and so if our case rate comes down just a little bit more, we may be able to open up a few more things, but it's slow and steady to do so.
And Dr. Stamos?
Yeah, I think that people need to realize that the hospitalization numbers are a lagging indicator, and so we don't really know what's going to happen. We just had a big fire. We had tens of thousands of people who had to evacuate. We don't know whether that increased or decreased their potential exposure risk. You could be an optimist and say, wow, the smoke was so bad everybody was wearing a mask, so maybe it'll be decreased. But we'll see. I think it remains to be seen. We have seen an uptick in hospitalizations over the past 3 or 4 weeks. We were down to a low of single digits in our own hospital, and most of the surrounding community hospitals were at the same sort of low level, and we've had a surge recently. It seems to have plateaued over the last week and a half, and so we hope that will now come down again. But I think time will tell. Will Halloween be a surge cause or not? I think it really depends on everybody, using common sense and following the CDC guidelines.
And Dr. Clapper?
I really don't have very much to add to what was just said. I think that the more we can do to so a couple of different take on it is the more we can do to increase people continuing wearing a mask, doing social distance, doing those kinds of things, even as will allow us to continue to reduce the rate. Because I really agree with Dr. Stamos that we don't know what the fire did. Did people have to crowd into the other people's houses and potentially increase their risk? Or were they wearing their mask because the smoke was so high, so maybe it decreased it? And the other thing is, no matter where you are in that, it's really important to get your flu shot. And we really want to make sure that we don't have a flu epidemic going on the same time as we're trying to manage COVID-19.
All right, and Dr. Clapper, you each kind of spoke to it a little bit, but with regard to reopening, California has instituted a tier system. We all know that Orange County is in the red tier, but can you tell us some very practical things that Orange County can be doing or potentially doing better in order to get that case rate down so that we can move into that less restrictive orange tier?
Sure.
Dr. Solomon?
So, I think
Sure.
that the county...
The biggest thing is masking. There are still areas in Orange County where people are less likely to be wearing a mask if you're walking around than others. And it is very clear that masking helps reduce the spread of this virus. The person who's wearing the mask can be infected and potentially be able to spread the virus without having any symptoms for several days. And so wearing the mask reduces their ability to spread the virus. You can think of it similarly if you were taking one of those misters that sprays water and you see the spray come out. Most of those droplets precipitate quickly, some last a little bit longer. But if you were to put up a mask in front of that sprayer, you wouldn't see that kind of spray coming out. And so that helps there. In addition, for the person who could be infected, wearing the mask would reduce the amount of virus that they could get. And with some experience that we've seen on some of the cruise ships where people were wearing the masks, the severity of illness was less. Clearly wearing the mask helps on both of those fronts. So continue to be very conscientious on both wearing your mask yourself and also paying attention to others.
And Dr. Stamos, anything to add to that?
Yeah, well, I think, physical distancing and avoiding large groups. I mean, really, and then hand washing. So really, those are the most important things we can do is mask wearing, physical distancing, which includes not being with large groups, and then hand washing.
And Dr. Clapper?
Yes, and just to add, I think that as we think about going into the Halloween weekend, that it's really important to continue to keep stay in your household. So wearing the mask is really important, and stay in your household group. And so doing things that are more virtual Halloween, have fun at your house, decorate your house, think about how to have a candy scavenger hunt for Halloween or other kinds of things, because each of these holiday weekends where people have kind of let down their guard has what increases the surge potential that's going on. So really being diligent and intentional about wearing your mask and keeping in smaller groups, keeping to your household, and figuring out other ways to have fun this weekend is important.
Wonderful. Thank you so much. Now, while we're on the topic of case counts, it doesn't appear, at least to me, looking at the numbers, that there's been any real significant uptick in cases, as many school districts throughout the county have resumed to partial on-campus instruction. Is this in fact true, and what should we make of this? Dr. Solomon?
So we've been watching for an uptick. We've been worried about it. We've definitely seen it occurring in the state, and there have been some increases in hospitalizations. Back in September, or actually during the summertime, closer to July, there was this large upswing that we saw in cases. We saw it very quickly in our urgent cares, the number of patients that were coming in to get seen, the number of tests that we were doing, and that positivity rate, the percentage of people who tested positive after being tested, jumped up to about 10% or so. We saw it very quickly, and then we saw that spike in hospitalizations, ICU come in right away. We haven't been seeing that yet, even though school's been in session for a little bit of time now, but we are staying very vigilant to watch that.
And Dr. Stamos?
Yes, I agree. I think, so far the schools are looking really good. We're doing some studies at several of the schools locally, including both in Anaheim as well as in the Newport Beach area, and so far it looks really good. I think people are being careful. People are being diligent about hand washing and masking. The teachers are motivated. I think the parents are motivated, and the kids, by reflection, are motivated as well. At UCI, we actually been doing asymptomatic testing of all of our students. We have far fewer students than normal, but we have around 7,000 plus students on campus, living on campus. We've been doing weekly asymptomatic testing on those students, and the positivity rate has been quite low, well less than half of what is seen in the community at large. So we are very fortunate, and I think a lot of that has to do, again, with education and diligence and compliance.
And Dr. Clapper, do you have anything to add?
No, I know that the schools are working really hard at trying to think outside the box, whether it's doing hybrid, doing other things. But as has already been said, the most important part is doing that diligence, having people wear their mask. I just participated in a virtual conference with school nurses, and really what Dr. Solomon said about the importance of masks, that another way to think about it is smoke. Right? That you see someone smoking, you see the smoke in the air, and then you see falling down. If you're wearing a mask, you're not going to see that out in the air. And it also gives you the idea of why that there are some particles that stay in the air. And that's why, you have to be conscious of that, and really went through the things to open the windows, turn off the fans, and all the other things, because ventilation in the rooms is also important as people come back to school.
All right, so there have been a lot of recent reports warning of an impending second wave of the coronavirus. Are your health systems expecting a second wave? And if so, what can you tell us in terms of the timing of the second wave, as well as what your organizations are doing to prepare for it? Dr. Solomon.
Sure. There's a definite concern about a second wave. We've got the typical cold and flu season coming up, and it's difficult to distinguish COVID-19 symptoms from influenza-like symptoms. And so the concern is, will there be people that are getting the flu, getting other typical viral respiratory infections during the course of the winter, starting to come in? In addition, as the weather gets a little colder, people may be congregating more. We have a lot of holidays coming up. Families typically gather. And so all of that is a potential concern. We are not necessarily expecting a surge, but we are definitely prepared for a surge if it were to happen again. We are strongly encouraging people to get their flu shot to try to reduce the likelihood of them getting sick from influenza as that season comes to fruition. And also are just prepared with testing. We're actually more prepared now for testing than we were earlier when the surge happened. So we'll be able to identify people a little bit more readily.
Fantastic. And Dr. Stamos.
Yes, I'm an eternal optimist, but I think another surge is inevitable, unfortunately. I think all of the epidemiologists, all the experts point to it happening. I think we can attenuate it here in Orange County. I think we have the benefit of having favorable weather, which I think is not so much that the weather itself prevents the spread, but it prevents the behavior that then potentiates the spread. So I think that we will not have as big of a surge as some places in the country, but we will likely have a surge. It's not clear to me whether it's a second or a third surge, because if you look at the data, we actually are probably right now starting our third surge. And let's hope that we can flatten that curve and keep it really low. Honestly, if everybody would pay attention to the things we talked about earlier, masking, physical distancing, avoiding groups, and hand washing, honestly, I think we could be in favorable situation with everything reopening literally within 4 weeks.
Wow, that's good news. You did say you were an optimist. All right, and Dr. Clapper.
I just want to reiterate with what God said. I think that we're all concerned about the next surge coming or second wave, and I think that I agree that it's so important to keep the windows open or be outside. And we are lucky in Southern California and Orange County to be able to realistically do that year round, unlike other places. So I think really thinking about that is going to be important.
All right, so you kind of spoke to it a little bit, but in addition to this global pandemic, we're headed into flu season. All right, do we think that this is something of a perfect storm? Are our testing centers and our emergency rooms going to get inundated with people as they try to contend with both diseases? Or, I could maybe make a case for the opposite. You've got people socially distancing, wearing masks, washing their hands more. Might we expect maybe a milder flu season? Dr. Solomon, what do you think?
I think you've hit the debate right on the head, and that's exactly the same debate that everyone else is having. There is a small possibility that this is a lighter flu season than typical. We've had many more requests to get the flu shot than we have in the past. We actually ordered a larger supply so we'd be prepared in case that's what happened, and indeed it has. People are masking, people are washing their hands. Those things not only prevent the spread of COVID, but also prevent the spread of the influenza virus as well. So there's a chance that it will be less. On the other hand, as the flu starts to come in, people start coughing and sneezing, that would enhance the spread of COVID. The positive thing is that we do have some experience from our neighbors in the southern hemisphere. They've already been through their winter, and fortunately for Australia, they found that both their flu and their COVID were lighter than they had anticipated. That doesn't necessarily mean it will be the same thing here, and again, we need to anticipate that it will be worse, but there is a good argument to say that it may not be.
And Dr. Stamos, and just a question too, how should they tell the difference? If they have symptoms, what are they supposed to do?
Get tested. It's very difficult to tell the difference, quite frankly. I think we will indeed have a lighter flu season, not just this year, but future years, because what we're learning today about infectious spread will carry forward for future years for the flu virus or any other virus that may pop up over the next decade or two of our lives. So I think we've learned a lot, and I hope that we take it to heart and recognize it. We have mandated flu shots across UCI with very few exceptions, and I think that will help the increased use of the flu vaccine, which is effective. Not perfect, but it is effective. So I'm optimistic that I think we'll have a lighter flu season, but nevertheless, a combination of COVID and flu will tax our health systems and will kill people, no question about it.
Wow. And Dr. Clapper.
So I think I totally agree with what's been said, and I think it's really important. What can you do? I always think, what can I do today, or what step forward can I do? And getting your flu shot today, if you haven't gotten it, would be your first step. Encouraging your family, your team members, your employees to get their flu shot where you have the opportunity to mandate it. For Cigna as an employee, and I work on our Cigna employee account policies, and that where we had healthcare workers, so with our home health, or we have specialty pharmacy at Credo or other actual healthcare workers, we did mandate it and became much more strict on waivers this year. And then for our non-healthcare provider employees, we increased the expectation and increased the incentive that people receive for getting the flu vaccine to really encourage our employees to get the flu shot. And I think that, so anything anyone can do, whether it's, and we've really worked on making the flu shot available. So see your doctor, call your doctor and seeing where in the healthcare system. Like Dr. Solomon said, the Memorial Care has done a great job at making flu shot available in multiple locations at multiple times. Cigna has made it available through pharmacies, and there are multiple other ways. We've really worked on some community events and other ways. How do we make it easy and safe for patients to get the flu shot? Because that's really something that you can do today. Make a plan. I think that's the other thing, is really make a plan. And there are different kinds of flu shots. So if you're over 65, you need the flu shot for over 65. So really call ahead. A lot of times, because of what's going on with COVID, you do need an appointment. So, and then maybe a drive-through. So make an appointment, make a plan. When are you going to do it? Get an appointment, and make sure you're getting the right flu shot. And I think that's really something you can do today. The other thing I wanted to mention is that if you are having a cold, or you think maybe I have the flu, I do think it's important to go get tested, particularly for COVID-19, because I know about a couple spreading events where someone thought, I'm just having a summer cold. So they invited people over. They had, extended their family household bubble. And later, all those people ended up with COVID-19, as well as when they went home, their other families ended up with COVID-19. So if you are having cough, cold, loss of taste and smell, GI symptoms, things that could be something else but could be COVID, that would be important to go get a test to find out what you have.
All right, so we talked about the flu shot, but let's talk about the vaccine. There are now 11 vaccines in the final stages of testing, and we've heard reports that the vaccine could be available as soon as before the end of this year. What do we think is a realistic time frame for when the vaccine will actually be available broadly to Orange County residents? Dr. Solomon?
So there are 4 vaccines in phase 3 trials in the United States right now. 2 of them are clearly front runners compared to the other 2, but they're all moving along pretty well. We shouldn't have results for another few weeks for the very first one, which is from Pfizer, and then Moderna's vaccine probably will have results shortly thereafter. The FDA has said that they want to have data on people for a couple of months after they get their second shot. Both of those vaccines need 2 shots. And then there's the FDA approval process and then the distribution process. So all of that probably means that we're not going to be receiving vaccine to start distributing in Orange County until probably early the beginning of 2021. It would be optimistic to say the end of this year. Is it completely out of the question? No, but not likely.
And Dr. Stamos?
Yes, I think that's very accurate. I think we might see first responders get access in December, because that will be the first wave under an EUA, most likely an emergency use authorization from the FDA. But I think widespread will be, if we're lucky, it'll be January. It might be February or March before we see widespread availability in Orange County.
All right, and Dr. Clapper, any other information on that?
No, we're really thinking that the vaccine's going to be available in first quarter for the top priority, which would be first responders, healthcare workers, the military, and people in high-risk categories. There's California has, and nationally we're working on prioritization groups. So I think that first quarter, we really think it's only going to get to the high priority groups, and second quarter is when we're going to see vaccine available for everyone else. And as we speak, people are currently, one of the things that's happened, I think, with this vaccine production is not only have we had so much focus on getting a vaccine and multiple vaccine manufacturers working through the process, but we've also seen the same work on gearing up manufacturing and gearing up the distribution so we can really compress the time between the EUAUs and being able to get it out and into distribution to all of us.
Wonderful. So you touched on distribution, and I want to go further into that. We all saw the logistical struggles with getting people even just tested for COVID-19. How are your organizations preparing for large-scale distribution of the vaccine and essentially, successfully inoculating a majority of the Orange County population? Dr. Solomon?
Thank you. I didn't want to interrupt anyone. So the government has Operation Warp Speed, where they've contracted actually with the Defense Department, who's very good at organizing large-scale implementations. And so they've got a distribution set up that they've planned or in the process of planning, and they're working very closely with state and local health department officials on how that distribution will work. So this will be a very organized structure, and there's a tiering system to make sure those that have the highest risk of either contracting or spreading the virus to get vaccinated first, and then tiering that down to make sure that that everyone will get vaccinated, but prioritizing it appropriately. So I'm actually on the California Hospital Association has a committee that they brought together where they're discussing that prioritization, who are those that probably should be vaccinated first for safety, and then going on down to see how the subsequent vaccinations should occur and how best to make sure that everyone is able to get a vaccination.
And Dr. Stamos, at UCI, what are you doing to prepare?
Well, I think, we're using also traditional methods of vaccine distribution, so we're not going to invent something brand new. There's no need to. We've done widespread vaccinations for many years. I do think it's interesting to think about we have time to prepare. Based on the data that I mentioned earlier about the percentage of Orange County residents who have already developed antibodies, is there a way to test more widespread for existing antibodies indicating prior exposure? We have really great information that just came out yesterday also showing that you do indeed develop long-term immunity when you've had COVID, even mild to moderate disease, at least 5 months based on data coming out of New York State. And so it'd be ideal if you could avoid vaccinating 12% of the population that probably don't need it. So I think that'd be an intriguing opportunity. Not sure how you would implement that. That will create challenges, but it is also, challenges are also creating opportunities.
Wow, that's super interesting. All right, and Dr. Clapper, what do you have to add?
I think that one of the other things that, besides the distribution, is that we're really putting, I think, more thought and learning into thinking about vaccine registry, making sure that people, that everyone gets the vaccine and being able to identify people who, gaps in care of people who still need the vaccine. So I've seen some innovative ideas and what people are trying to put in place, whether it's barcoding or other kinds of ways, better connection of the registries that we have so we can track who's gotten it, who needs it for the top priorities Dr. Solomon talked to, how do we get the vaccine to the people who haven't gotten it, and how to track down the last couple of folks at the end to make sure they get it.
All right. So in addition to the discussion around the vaccine, I understand that treatments for COVID-19 are improving. In fact, the President of the United States infamously just contracted COVID-19 and spoke about the antibody treatment that he received. And, by all accounts, he did pretty well. So where are we with treatments, and what is the current standard of care for somebody who contracts COVID-19, and how has that evolved?
Well, there's a lot to unpack there. The interesting thing about this virus is it is very variable on the symptoms that a patient gets from the virus. How sick will they get? And it has to do with a lot with their comorbidities, but also it is still variable. There are a lot of things that we're not aware of that may contribute to how sick someone gets. We've been fortunate at Memorial Care to be able to participate in some of the trials. We've participated in the remdesivir trial, also in trials on convalescent plasma. Both of those things have now received this emergency use authorization so that they are available instead of only being available through those trials. It's been very interesting to see the difference between some of the hype on some of these medications and the realities of the data that's coming out. We're still very early on the published trial results, and it's important to pay attention to those things. Sometimes you'll hear about or read about things in the news, and the trials haven't been published or peer-reviewed yet, and that's very important. Because early on, if you remember, there were some stories about hydroxychloroquine, and once those trials came out and were published and reviewed by physician peers, they realized that some of the designs of those trials weren't quite as up to standards as you would expect, and maybe the results weren't as robust as they were thought to be. So remdesivir had a very good trial that showed a reduction in length of stay in the hospital. It didn't necessarily have a reduction in the number of people that died from the virus, but it did shorten the length of stay. In another trial more recently, it didn't look like it had as much of a robust length of stay reduction, but again, there was no morbidity benefit from those. There are also these two monoclonal antibodies that have been receiving some press just recently. Only one of them has a trial that was just published. It was a phase 2 trial that just came out in the New England Journal of Medicine, I think this week. About 450 patients were studied in that trial, and despite what is, if you look it up and read about it, the trial was designed to look at a reduction in viral load. That was it. That doesn't necessarily mean that it does anything beneficial for reduction in length of stay or hospitalizations itself, but it did, in this secondary analysis, have some trends to reduce the number of people that went into the emergency room or got admitted. The other trial that was by Regeneron did not get published yet, so we can't really review those results. One thing to pay attention to when you see some of these studies, they'll come out with these huge numbers, 50%, 60% reduction. And there are two ways that you can look at an improvement. One is a relative risk of improvement, and the other is absolute. And to give you an explanation, If there are 2 out of 100 cases and it reduces it to 1 out of 100 cases, that's a 50% reduction, which just sounds like a tremendous improvement, but in reality, it's just a 1% absolute reduction. So when you see some of those big numbers, just recognize that they may be using that in higher number to sound more impressive than the data actually is.
Yeah, well, I mean, that makes sense. All right, Dr. Stamos, what about treatments?
Yeah, I think paying attention to detail is important. I completely agree. We've had now 3,700 patients admitted to UCI over the pandemic length. You can take that number and multiply by about 5 or 6 for the UC system as a whole. And we've captured all that data. We have tremendous amounts of data. We've fed that into an AI algorithm. We have some amazing scientists working on that. And they've actually helped us modify how we approach every single patient. So patient number 2 got treated better than patient number 1. Patient number 200 got treated better than patient number 1 and number 2, et cetera, et cetera. It's been tremendous. We've shared information broadly across discipline. That's what we do. And so we've learned from others as well. We learned from New York. We learned from Italy. We learned from Memorial Care, of course. We also have had numerous patients on clinical trials, including Remdesivir 1, Remdesivir 2, and Remdesivir 3 trial, because as it became standard of care, it became added on to other treatments. I'm excited about the monoclonal antibodies. What it looks like is happening based on the data that has been published is that if you don't give it to the patient early enough, it doesn't work. And that's not surprising because they've already produced their own antibodies. So why would the antibodies help? And it's probably too late. So I think we've got to pay attention to those kind of details so we can be most effective. I actually think that my optimism earlier came out about behavior. I'm not that optimistic that it's actually going to happen. I wish it would. But behavioral changes could have the most impact of anything at all, number 1. Number 2, the antibodies I think will have a much earlier impact than does the vaccines. I think we're heading towards an EUA for a monoclonal antibody. It will enter into a phase 4 trial, which means that it's being given broadly at certain sites and then studied and followed for outcomes. And I think if that's successful, which I think it likely will be to some degree, I think that will have a much bigger impact than the vaccine until the spring.
Oh, that's wonderful news. All right, and Dr. Clapper.
Yeah, no, I really don't have anything. I think it was very well covered by Dr. Solomon and Dr. Stamos.
All right, well, we're going to go ahead and take a short break to hear a special announcement from our sponsor. We'll be right back, so stay tuned.
A name, like Nancy, Daniela, or Carl. And same as everyone else on the block, Bravery has a family. The foundations of Cigna and New York Life introduce the Brave with Heart Fund, providing healthcare workers with peace of mind and financial support if they lose their life. They're out there, protecting our families. Let's protect theirs.
Welcome back. If you're just joining us, my name is Kristen, your moderator for today's discussion, and I'm joined by our distinguished panel of healthcare experts from Cigna, Memorial Care Medical Foundation, and UCI School of Medicine to discuss the current state of COVID in our communities. Before we continue our discussion, I would like to remind the audience that if you have questions during our program, please make sure to comment below, and we will do our best to get to as many questions at the end of the program. All right, we're going to have a couple more questions and we'll get straight into those viewer questions. All right, so last March, the governor when he first issued the stay-at-home orders to mitigate the spread of the virus, there was still so much that we just didn't know about it. What has been the biggest lessons that each of you have learned about coronavirus over the last 7 months?
I'd say the largest thing really is the efficacy of masking. If you remember back at the very beginning when this started, there was a discussion of whether or not masking truly helped. And it is very clear at this point that masking reduces the spread of this virus, and that simple step, along with the social distancing and hand washing, would be enough to dramatically impact the spread and possible next wave of this virus. The other big things that we've learned have been around the management of those patients. Part of the reason why, even though deaths are a lagging indicator of a surge, and even though we've seen a slight increase in the number of cases and hospitalizations, the number of deaths haven't risen yet as much as they had before. Part of that may be just because it's lagging, but some of it too is I think we've really learned a lot on the treatment of these patients.
Yeah, let's hope so. And Dr. Stamos?
Yeah, ditto everything Dr. Solomon says, 100% agree. And I would add to it, what we've learned also as an organization is that you cannot over-communicate. It's just so important. A lot of people are scared. They really are. And I know pandemic fatigue is setting in, but we have to be really careful and diligent. I would hate to think that the 6 months we've been careful and diligent in the past all goes for naught because we all of a sudden start slipping up and not being careful. If we all really want to see this pandemic end in Orange County as soon as possible, we will all be extra diligent with all of the things Dr. Solomon just mentioned.
And Dr. Clapper.
And Dr. Clapper, anything to add?
Yes, I totally agree that masking, when you think of where we were at the beginning to where we are now, the amount that we know about masking works is important. But I think a couple to other things I'd like to add is one, the ability for the providers to, UC Irvine and Memorial Care and other providers to really turn so quickly and adopt telehealth and virtual care and really think through to get patients the care that they need. I think that it's been impressive, and as someone who's worked in digital health and virtual care for a long time, and you work on it so hard, and how do you see any adoption? And in like 2 weeks' time, we saw this like wide range across the healthcare system, all providers, doing virtual care, and it was, I think, really impressive. And I think for the people who are participating today to know that they can get excellent care through virtual care and really work with their provider on what's the right. You can get seen safely also. So really talk to your provider or your provider's office about what's the right modality for you to get seen with. But just the whole virtual care, tracking, remote monitoring of patients with COVID care through their electronic health record, that's another. So the combination of virtual care, remote monitoring. And the third piece is really the change in office workflows. So I've heard about people so they getting their flu shot and they don't want to go into the office. The office staff has seen them around the back door so they don't have to come into the office, drive through, other kinds of ways, really having the healthcare community think outside the box on how do we get care timely in new ways to the community to keep them healthy.
Yeah, you talked about telemedicine, and I think that it's definitely here to stay, and as well as a lot of the creative solutions that the providers have come up with during this time. It's wonderful. So we're going to go to the audience now. You actually all three spoke about masks, and we have a question here from Charla. All right, she says, do the doctors on the panel have recommendations for which types of masks work best? There are so many options on the market.
Well, wearing something is better than wearing nothing. Probably the least effective are those gaiters that you sometimes see. Ideally, those cloth masks should be 3 layers if possible. Some of them will have an insert that's there that can be used as a filter and can be cleaned. The other one that I would also discourage people from wearing are the ones that have the valve on them to simplify breathing. That nullifies the whole point of the mask because the breath comes straight out. We've generally encouraged people to leave the surgical masks available to healthcare providers so that they have enough available. But again, those cloth masks, triple layered, they should be adequate for just general use in the population.
And Dr. Stamos, anything to add?
Only I would just highlight the work of a couple of our young trainees and faculty. One of our faculty in anesthesiology and one of our trainees, a resident in dermatology, went and found material that's in every operating room in every hospital in the country. It's used to wrap up instruments, sterilize. It typically gets thrown away, so added to the landfill. And they actually studied this. They worked with an incredible scientist at MIT and discovered that this product can be used to make masks that are as effective as any other mask out there, short of an N95. And they're now mass producing those and sharing them across the UC system. And we're sharing those with others as well. So I think that's, those sorts of creative ideas. But there is lots of data out there. And I think Dr. Solomon laid it out pretty carefully and pretty concisely.
Dr. Stamos, is that the mask you gifted me before the show?
That is not, but I'd be happy to gift one of those also.
All right, and Dr. Clapper, anything to add on masks?
I totally agree with what God said. The thing I want to caution people or add is that you see people with face shields. And what we know about face shields is that they're good at for eye protection, but they have the same problem that like bandanas have, that the air particles or aerosolized particles can come out the bottom. So you really want to wear something that fits to the face. So I really recommend, as Dr. Solomon said, the triple layer cloth masks work great. That's what I wear myself in my day-to-day life, and that that will work, and that allows us to leave the surgical masks for the healthcare providers.
Well, there you have it, folks. Those are really excellent recommendations. All right, we have another question here, and Dr. Stamos, I think this one might be directed towards you specifically. We have Chuck Gibson here asking, he says, this morning we read a report that there was one study, there seems to be higher rates of antibodies in the Orange County population than first thought. What are the implications for rate of achieving herd immunity? Great question, Chuck.
Yeah, I think we've known for a while that the actual rate of infectivity is higher than the rate of known infectivity, right? Because if you don't get tested, then you don't know. And so this is a really nice, well done, broad antibody study. So looking for antibodies specifically against COVID-19, using a multi-antigen array that was developed at UCI by a couple of our great scientists, Phil Felgner and his team. And they took 3,000 randomly identified members of the Orange County community and tested them. And what they found was that the overall rate was just short of 12%, as opposed to the known rate of 2%. So about a 6-fold increase. People have thrown out numbers like 10-fold or 5-fold, but now we know, at least in Orange County, within the realm of the power of this study, it's about 6-fold above what we think it is. That's far short of what's needed for herd immunity. Herd immunity, depending on who you believe, the experts say 70%. Some people say it might be as low as 40%, but it's certainly far more than 12%.
All right, I actually have a follow-up question, because this report
was super interesting to me, and I took a look at the numbers. You know, it looks like in Orange County, the virus has killed 1,460 residents out of 59,213 confirmed cases. So if you're telling me that the rate of infection is actually 6 times higher than that number of confirmed cases, isn't that really excellent news in terms of the death rate?
That's right. So we don't know true mortality rates because we don't know the true denominator, right? So we only know what we know. Now, having said that, I think there's some data out there that actually the deaths attributable to COVID-19 are actually higher than we know or than we think. So somewhere in between there lies the truth, but I think the death rate is probably about 20% of what we currently believe it is, based only on tested population. But it's still, the numbers aren't different. The numbers aren't lower. Still the same number of people have died. Just it's a percentage in terms of the likelihood of dying if you acquire COVID-19.
Fantastic. And it sounds like it gets us closer to that herd immunity rate, right? We've got a head start.
We have a head start.
Can I make one comment?
Sure,
about
absolutely,
the
Dr.
serology
Solomon.
testing? So there was a bit of a demand for serology testing. People wanted to get tested for antibodies. In general, those don't necessarily help treat an individual person. They're really great for population studies to get an idea of how many people in a population likely had infection, and the quality of those tests have improved. Initially, some of those tests cross-reacted with the coronavirus that people get during a normal cold and flu season, but now they're much more specific, so we can get an idea of who's been exposed to the virus and set up an antibody response. The thing is, sometimes people have antibodies that aren't what we call neutralizing antibodies. Those are the antibodies that prevent the person from getting sick from the virus. These tests just detect the presence of antibodies. And also, going back to a comment earlier, that if a person has those antibodies, they do seem to last longer than we had thought. But again, that doesn't necessarily mean it is providing adequate immunity. So there is still this question out there as to whether or not people who have the antibodies truly are immune and don't necessarily need to get vaccinated. And if you get vaccinated, is that good for your lifetime, or might you need another vaccination in a year or 2 or 5?
Wow, there's so much there. I want to give Dr. Clapper a chance to respond to this question as well. Anything more to add?
No, I think the question about herd immunity has been, I think, really hard, and I get a lot of questions about that, because we really don't know, as Dr. Stamos said, is it really at 70%? Is it going to be, some people argue it could be lower, that there may be some benefit with this cross-reactivity, and there's different thoughts about it. But even if we say, cut the difference on that, and we say something like 55 or 60%. Being where we are in Orange County, to getting to that point, there's still a big gap. And so while we have a step ahead, it still goes back to our early part of the conversation that people need to wear their masks, do the hygiene, and do those things, because we're not anywhere close to herd immunity. And the other part, I think, of the message when we think about the results from the antibody study is so many more people had been infectious, and you could have contacted COVID-19 from them, and they didn't even know they were sick. So I think that speaks to that there's asymptomatic spreaders in the county that they don't know that they're sick. Maybe they think they're having their fall allergies. So I think it brings into mind that you still need to be diligent and have compliance about the mask wearing and social distancing.
Wonderful. Thank you for that. We have another question from the audience, this one from Gigi. Going forward, what do you recommend for students going back to school? Should students and teachers be required to get the vaccine? Dr. Solomon?
I'm always hesitant to say that people in the community should be required to get anything done necessarily. There are certain things to say for public safety, and we do require vaccination for childhood diseases just to protect the rest of the community. I think it is something that our health officials and our school systems need to really evaluate. I think we need to look at more details on the efficacy of the vaccine, how readily available it is, before we start talking about people being required to get the vaccine.
Dr. Stamos, anything to add?
No, I think that's right. Let's wait for the data and see how effective they are, how safe they are. I think in an ideal world, you'd have a perfectly efficacious, a perfectly safe vaccine, and it would be required. But we're far from a perfect world, so I think we'll wait and see what the data shows.
Wonderful. And Dr. Clapper?
I do think it's, I think as what's been said is that we do need to look at the efficacy and the safety, but just like with other vaccines of childhood vaccines for school attendance or for college attendance and other kinds of professional attendance like healthcare workers, that we're going to start seeing the COVID-19 vaccine as it becomes available, be included on those vaccine schedules. And it is for the public safety. It is to protect not just the person, but also the other community members that they're around. So I do think we'll see that, and that there are medical waivers and things like that are available, but we do need to increase, we do know that it saves lives to increase vaccination rates when we have vaccines that made the point of making the U.S. Preventive Services Task Force and other immunization, the American Academy of Pediatric and the other immunization board recommendation tables. So I do think that they're going to end up being recommended and required, just like other vaccines in the future.
Wonderful. And so as we wrap up here, I want to give everybody an opportunity to just say some final comments. We opened this program saying that, people have pandemic fatigue. I know I do. We hear a lot about COVID. And so just in your final comments, what advice do you have for our viewers? Should they remain as vigilant as they have been all these months, or, should they find ways to adapt to this new normal? What do you say, Dr. Solomon?
So I think we shouldn't relax now that we're finally getting to the point where we're stabilizing, despite seeing it start to spread even more up in Europe and other places. So number one, please, everyone should be wearing their masks. It's absolutely essential. That is the largest thing that we could really do to help prevent the spread. And the other thing, as I mentioned earlier, with this holiday season coming up, families love to congregate together. But when people are in a small space indoors breathing, that increases the concentration of virus that's in the air, increases the risk for other people to get it. So please be considerate about that during the season. And then also try to get out, get some fresh air, eat healthy. With this pandemic and people feeling some social isolation, taking care of yourself has become a little bit more difficult. People aren't eating as well, people aren't exercising as much, and their mental health is a little strained. So making sure to take care of all of those things, taking care of yourself and those around you, really is very important this holiday season.
Yes, I agree. The COVID pandemic has led to a mental health pandemic. There's no question about that. We've seen it. Others have seen it. And what can you do? Take care of yourself. Take care of your loved ones, right? It doesn't have to be the same way you've always done it. I know it's so tempting to do so, but don't relax now, because we're not rounding the corner yet, unfortunately, but we are able to at least see some light at the end of the tunnel. And if we relax too much, it will hit us like a freight train and not be the light we want to see. So please try to maintain your diligence, continue with your efforts to prevent this pandemic from becoming worse in Orange County, at least, and then just take care of yourself. And that includes, by the way, taking care of your usual and customary health issues. We know, good data, good experience, that going to your doctor, going to your hospital, going to your local health provider is safe. And so please don't ignore your own health, whether it be your routine colonoscopy, your pap smear, your mammogram, or any other health issue that might be impacting you. Please don't ignore it. If you can do it by telemedicine, that's great. We've certainly learned a lot, and we can do a lot, but we can't do everything by telemedicine. So we want to make sure we balance that with the need for actually taking care of ourselves.
Wonderful advice. And Dr. Clapper.
Yes, so I think wear your mask, get the healthcare needs that Dr. Stamos was just talking about, both for your preventive services, your mammogram, any other vaccines, other things, and also your chronic diseases. This is the time to be taking care of making sure your blood pressure is in control, your diabetes in control. It is safe to go to your doctor. They have so many safety precautions in place. So you should feel very safe in contacting your doctor and getting taken care of. And I think it's really important to think about the mental health. And as I know Dr. Solomon and Dr. Stamos brought that up. And there's multiple avenues on how to take care of your mental health. So self-care, mindfulness, making connection either with your household, talking about how you're feeling, taking time to just do some deep breathing, go for an outside walk, have virtual connection. So really try to create that connection. And I think if you're really feeling despair, fatigue, that you just can't keep doing this, it's just going on too long, really a lot of anxiety about leaving the house, there's many symptoms that people are having that take advantage of your company's employee assistance program, their EAP, talk to your doctor about it, see a therapist. This is a time, I like to think about this as like when you get on a plane and they talk about putting on your oxygen mask. It's real, take care of yourself first, because that's the way you can then take care of your family. If you have children, help them, because children are going through a lot in terms of daycare and school and college. What's going on? What can they expect? And then your parents. Our parents who are not going to work, they're not going to other things, and they're feeling particularly isolated. And so you really need to take care of yourself first so you can take care of the extended family that are all going through this and feeling lonely and disconnected and frightened, anxious. So we have a lot of positive news in the future, but we really need to be diligent in this fourth quarter coming up until the vaccine's available.
That's all really wonderful advice. And that's all the time we have, folks. Again, we want to thank our sponsor, Cigna, as well as our healthcare experts for taking time out of their day to help us prepare for these coming months ahead. We certainly appreciate you and your service to the community. And I'd like to thank the South Orange County Economic Coalition for bringing us today's program. This organization is made up of volunteers like myself who are dedicated to advancing the interests of the business community in South Orange County. If you would like to learn more, please visit www.economiccoalition.com. And I want to thank you, our viewers, for tuning in today. Be sure to join us again for our next live monthly membership meeting on Friday, November 20th, right here on Facebook Live and YouTube Live as we discuss this November's election results. There is sure to be a lot to unpack, folks, so you do not want to miss it. All right, we look forward to seeing you again next time, and if you haven't done so already, please be sure to get out there and vote.